Good afternoon, Shiny. My name is George Withrod. I'm the invigilator for your oath speaking test.
Hi, good evening.
And what is your candidate number, please?
My candidate number is 23050246447.
Thank you. Can I see your ID, please?
Yes, sure.
The warm-up questions are not assessed as a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes. What type of work environment do you prefer?
I do well in a range of work environments. But I think the environments I've enjoyed most in my career are smaller organizations, where I can focus on giving great care to each patient that comes in without feeling rushed.
Would you describe yourself as an organized nurse?
Yes, I would. I like to have a checklist and make sure that each item gets the attention it needs. I'm very organized and thorough, and I think this has definitely made me a better nurse.
What do you think of your previous boss?
My last boss at the hospital where I worked taught me the importance of time management. He was extremely deadline-driven and wouldn't take excuses if the job wasn't done properly and on time. His no-nonsense approach pushed me to work harder and manage my caseloads much more efficiently.
What really motivates you?
Doing the best I can for every patient. I believe that every challenge can be overcome with the right attitude and hard work. I love nursing, and the thing that motivates me every day is knowing that I am making a real difference to people's lives, whatever particular illness, injury, or trauma they are facing in their lives.
Nursing can be stressful. How do you handle stress in your life?
Over the past couple of years, I've been practicing breathing exercises and meditation. Both have been very effective in reducing stress while on the job and after a shift. I also like to exercise regularly by going to the gym and doing yoga. Finally, I spend time in nature when I'm not working. I've found that's a great stress reducer.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the first role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Good evening. My name is Sophia, head nurse in charge.
Good evening, nurse.
How may I address you?
My name is Shinny.
Hi, Shinny. You seem to be very upset. May I know the reason, please?
I'm unaware about how badly my husband was injured, and is he all right now?
He is all right now. He was having minor injuries only. The surgery was also a minor one. But there will be a little pain, which is quite normal in accident cases.
May I know why the surgery was done before I came?
Sure, I can explain it. Paul's knee was broken in the accident, and on X-ray, his nerve was squeezed and affects blood flow. So immediate operation was necessary to keep his leg functional as normal.
Oh my God. If you don't mind, can you tell me whether Paul was in very pain when rushed to the hospital?
Shiny, do not worry. He's all right. He was quite unconscious, and he didn't feel any pain.
Oh, okay.
Well, Shiny, I need a few details from you related to Mr. Paul. Can I ask you a few questions, please?
Yes, sure. You may please.
Thank you. Please, do let me know if your husband had any medical problem in the past.
Yes, Paul has been suffering from blood sugar for the past 5 years. Other than that, he is totally healthy.
All right, thank you for the information you have provided.
Nurse, I am really concerned about that. I have heard from many that people with blood sugar require more time to heal than normal. Is that true?
Well, I am glad to explain it to you. What you have heard is true, and it is because of the decreased blood circulation. But, don't worry, our doctors are really experts. Moreover, we have a specialized diabetology department where your husband will receive extended hands of support in his recovery.
So, I believe my husband will recover properly.
Nothing to worry, Mrs. Paul. He is in safe hands, and he will have a very faster recovery with the proper treatment and continuous follow-up.
Nurse, will he be able to walk properly after the recovery?
Yes, of course. I am sure he will. You do not worry about it. It was just a minor operation.
To see him in this condition is really heartbreaking for me.
He will be perfectly well. As he is having an injury with his knee, he needs to do some physiotherapy, and also the injury will take some time to heal. But, definitely he will get healed.
May I know how much time it takes to heal?
Well, we can't say the exact time required to heal. But in the course of 2 to 3 weeks, he may get well. He will be able to walk around with the help of a walker. But care shall be given, and should avoid carrying weights and activities that pressurize the knee.
Yes, I understand that. Nurse, will there be any marks or stitches?
For the initial time, the stitch mark will be visible. But, ointments will be provided to spread over it, hence the marks will fade off gradually. Do not worry about the marks.
How about the physiotherapy? Does he need to visit the hospital for physiotherapy?
During the hospitalization period, our physiotherapist will demonstrate and teach some exercises for a speedy recovery. After getting discharged, the patient can do it by himself with assistance. But weekly consultation will be there.
Well, is there home visit option available for weekly consultation of a physiotherapist?
Yes, sure. Home visits can be arranged. You will have to just fill out a home visit request form at the reception. One of our experienced physiotherapists will visit your husband weekly and do the consultation.
All right. That will be really helpful.
Do you have any more concerns?
One more thing, nurse, how long will it take to discharge from the hospital?
Hopefully it may take a few days. Doctor will make the final decision regarding the discharge after a consultation.
Oh, I see. Thank you, nurse, for your valuable time.
You are very welcome. If the patient needs any assistance, please ring the bell left to the patient's bed.
Sure. Thank you.
Thank you. I wish your husband a speedy recovery.
Thank you.
You are welcome. Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.